Lord, help us to be who you want us to be. Blessed assurance, Jesus is come. I've been here since 1951 when my parents moved here. My father worked at Mike's Car Wash. That was his first job. If I had money, I would buy these hotel things they have empty. That just come, get a breakfast, a donut or something, and enjoy. Get some sleep, good sleep. Because that could be my family out there. Right there on Clay Street, right at the corner there, I saw a lady. It had just rained and she was laying there resting. So I worry about them and they don't even concern me. But when you love God's people, what can you do? The phone started ringing about 8:25 or 8:20, somewhere in there. And I answered and they says, could you help me? I need to be a patient. We're here not to judge you. We're here to love on you, take care of you, and give you the opportunity to have good health.
Matthew 25 provides compassion and care for individuals that are 18 and over, that are without health insurance, and they are low income. And we provide everything from primary care, specialty care, dental care, vision care, and medications to individuals at no cost to them.
So I got diabetes, and they were saying, go call Matthew 25. I said, I don't know nothing about no Matthew 25. They said, well, you call, they gonna help you, and you don't have to have any money because you don't have any. I said, okay. And I came in, and they took care of me. And I thought, this is not real. It can't be real. But it was real.
Thanks to a lot of support from Parkview and other charities in the area. They built this beautiful building. It's entirely different than it used to be. It needs to be because our population, the people we serve, are so much more numerous.
If you think of our patient population, there are so many different barriers outside of healthcare that they may be experiencing. So when you think of that, they're going to need to take care of their family, feed their family, house their family, and until they have a really sore tooth or until they're crippled over in pain, healthcare is the back burner.
We pride ourselves in acknowledging that we are a safety net organization. If they need shelter, if they have been abused, if they need food or child care,
call us, we will help you. Then some they'll call and say, well, what about my income? What about this? I said, don't worry about that. Let us take care of that. I said, that's our job. I said, if you can't, we'll find somebody that can.
Having partners in place, knowledgeable people, all working together in a non-competitive manner is really what your safety net and your overall providers should be doing for your community. Depending on what study you read, you get a $10 to $14 return on every dollar that you put into preventive medicine.
Our main focus is to keep patients out of the hospital. Truly, the biggest asset that we can be to this community is to care for those that come in our door. If you can keep someone pre-diabetic versus diabetic, that makes a significant difference in their quality of life and what they're able to do.
You're also preventing ER visits, people being out of school or out of work. So overall, your economic stability in your community truly is based on preventive care.
After I wasn't a patient anymore, I started volunteering. And I liked doing that. That was good because I was giving back, even though I didn't have any money to give back, but I was giving back my time.
Our volunteers are definitely the unsung heroes, and we could not exist without them. We have people that come volunteer at the front desks. We have people in the medication room.
In addition to that, we do have a number of providers with Parkview. It could be nurses, specialty care, primary care physicians. They have packed schedules at Parkview, but when they're not providing care there, they come to us, they donate their talent, their time, their knowledge, basically helping to keep our patients healthy, safe with any care that they need.
Their hearts are huge. Truly, without our volunteers, Matthew 25 could not exist.
We try to treat the whole person because people are whole. They do have a body and soul. And with today's society and today's medical system, it's pretty easy to feel lost. And if you got somebody to help you guide through things, it's huge.
Because the people out there need help, and I put myself in their place because I was here. I didn't have insurance and I needed help. And the doors was open, so you just walk in and do what you gotta do. I need a Kleenex. When I get to talking about Matthew 25 and how it helped me and how it's to help other people, it's a passion. Matthew 25, we have people that can't help themselves. People come in here. You have to know the patients, and just because they come through that door, look at their eyes, see what they have, see where they're hurting at.
I wish everybody could come here and work a day sometime. It's a good experience for your soul.
When you got Matthew 25 here, why suffer? We get up every morning and come to work for you, to take care of you. And when you know that you're sick, call, come. The doors are open. Matthew 25 is open.